Cholangiocarcinomas are tumors that arise from cells of the bile ducts of the liver. The liver has small tubes inside its substance that they are called bile ducts, which carry the bile that the liver produces down all the way to the first part of the bowel, which is called duodenum. So the cells in the bile ducts can change and they can create cancers, and these cancers we call cholangiocarcinoma. A lot of patients present to us with incidental finding. That means that they have a test for something completely different, and on imaging, the doctors pick up any indication that they may have a problem with their bile ducts. Sometimes they can have what we call constitutional symptoms of cancers. These are generic symptoms like loss of appetite, unintentional loss of weight, fatigue. The most common specific presenting symptom is jaundice, and jaundice is a yellow tinge of the skin and of the white of the eyes, which we call sclera, and that happens because of the blockage of the bile duct from the cancer. Most patients with cholangiocarcinoma are detected incidentally. That means that they have tests or investigations for various symptoms, and the cholangiocarcinoma or problems with their bile ducts are detected on these tests. However, if they have symptoms that are maybe specific for cholangiocarcinoma, the first set of investigation consists with blood tests that usually the GPs perform, or an ultrasound scan. Then, depending on the results of these investigations, we will always need a 3D imaging investigations, such as a CT and an MRI scan. Then after these, further investigations may be required depending on the location of the tumor for us to be able to diagnose it, locate it, and form an appropriate management plan. The treatment options for cholangiocarcinomas depend on the location of the tumor. The tumors could be inside the liver, and they are called, in this instance, intrahepatic. They could be just outside the liver, where the entry of the bile ducts and the vessels are, and we call these perihilar tumors, or they could be further down in the bile duct, even close to the pancreas and the duodenum, where the bile duct empties, and we call these distal cholangiocarcinomas. In general, the best results come with a combination of systemic treatment and surgery. Systemic treatment is chemotherapy, and very recently there are also immunotherapy drugs that they have been approved to use in this condition. But the results are even better if these treatments are combined with a resection, with a removal of the tumor with surgery. The extent of the surgery and the type of the surgery depends on where the cholangiocarcinoma is located. It could be a relatively small liver resection, or a pancreatic resection, or even a combination of the two if the cholangiocarcinoma is very extensive and occupies a large part of the bile ducts. In any case, a referral to a liver and pancreas surgeon is indicated, so an appropriate management plan can be instituted. So liver transplantation is a relatively new treatment for cholangiocarcinomas. Liver transplantation has been performed and is performed in other countries for the treatment of cholangiocarcinomas inside the liver or at the entry of the liver. However, in the UK, at the moment, we do not have liver transplantation as an option. There are plans to institute this, and hopefully this will start probably in 2025.